Good afternoon. Today is Tuesday, March 9th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. With me today is Diane Oldenburg, Senior Public Health Educator for the County Health Department. It's exactly 1 year since the first county resident was quarantined as a precautionary measure after possible exposure to COVID-19. Since then, 158,030 COVID tests have been administered and 6,507 residents have been diagnosed with the virus. Fortunately, most have recovered, but 89 members of our Oswego County community have lost their lives to COVID-19 since we began the pandemic. We continue to remember them and keep their loved ones in our thoughts. We've made much progress in the past few months. We now have 26,693 county residents who have received at least one dose of the COVID vaccine. 12,117 residents are fully vaccinated. So we vaccinated twice as many residents than have been diagnosed with COVID. Our vaccination rate remains higher than the rate statewide, and we are steadily building up our population immunity. We are proud of the County Health Department and community partners, our first responders, healthcare workers, and all the volunteers who stepped up to distribute masks, deliver meals, manufacture protective equipment, and staff our vaccination clinics. It takes individuals and organizations working together at all levels to get a community through a crisis such as a pandemic. The Fulton City School District deserves special recognition. Since January 16th, they have welcomed our County Health Department team, volunteers, and community for large-scale vaccination clinics. They continue to allow us to use their high school gym every Saturday, even though school athletics have resumed. Thank you to School Athletic Director Christopher Ells, who coordinates the district's COVID response activities, and to School Superintendent Brian Polvino. You have gone above and beyond to support the Health Department and the Oswego County COVID vaccination program. Thousands of county residents have received first and second dose vaccines because of your hard work and generous support. As the COVID infection rate declines in New York State, the governor has eased back on some of the COVID restrictions. Today, the governor announced that beginning tomorrow, March 10th, all residents age 60 and older will be eligible to receive the vaccine. Public-facing essential workers from government and nonprofit agencies will be eligible beginning March 17th. This expansion also includes public-facing essential workers such as public works employees, social service and child service caseworkers, government inspectors, sanitation workers, DMV workers, county clerks, building service workers, and election workers. The governor also announced today that with the increased supply of the vaccine, some of the restrictions on who providers can vaccinate will be relaxed. Providers will be able to vaccinate any eligible resident, except that pharmacies will focus on residents over age 60 and teachers. Beginning March 19th, restaurants will be able to accommodate guests at 75% of their indoor capacity. Beginning April 2nd, events, arts, and entertainment venues can reopen at 33% capacity with up to 100 people indoors and up to 200 people outdoors. If everyone presents proof of negative test before entering, capacity can increase up to 150 people indoors and up to 500 people outdoors. The new gathering limits also allow residents to host 10 people indoors and 25 people outdoors starting on March 22nd. Other social gatherings in public spaces can have up to 100 people indoor and 200 outdoor. And now Diane will share this week's report from the County Health Department.
Thank you, Chairman Weatherup. As of today, our 7-day positivity rate is up slightly to 1.6%. A week ago, it was at 1% even. As of this afternoon, our County Health Department has administered 7,176 vaccines at 25 clinics. This includes 500 Johnson & Johnson vaccines, 4,371 first dose Moderna vaccines, and 2,305 second dose Moderna vaccines. We have today a total of 190 active positive cases. We've had 158,030 test results returned to the health department. We've had a cumulative positive number of cases at 6,507. Total negative test results, 149,369. Total number of patients released from isolation, 6,228. We have 89 deaths reported due to COVID by the New York State Department of Health. And we currently have 565 residents in mandatory quarantine or isolation. Since the pandemic began a year ago, our county health department has closely monitored disease activity on a daily basis. One of the indicators we follow up with is to compare 7-day new case counts from week to week and month to month. The 7-day accumulated new case counts peaked at more than 500 new cases in the middle of February and declined to 88 last Monday, March 1st. Yesterday, the 7-day count had almost doubled to 175 new cases. As vaccine supply increases and more residents get vaccinated, we have not seen case numbers continuously decrease as we would expect. Although vaccine coverage is increasing, the virus remains active. We urge residents to collaborate with us, remain vigilant, and continue their protective measures. Our health department is now posting links to vaccine clinics on Thursday mornings beginning at 10 a.m. To make an appointment, you can visit our website at health.oswegocounty.com. We've also set up a vaccine hotline from 10 a.m. to noon on Thursdays. That number is 315-349-3383. Appointments are expected to fill quickly, but we expect more appointments to become available as time goes on. Please be patient and check back often. You must bring proof of eligibility with you to your appointment. If you are making an appointment for a Pfizer or Moderna vaccine, you need to commit to getting your second dose of the same vaccine at the scheduled time, either 3 or 4 weeks from the date of the first dose. The Johnson & Johnson vaccine requires only 1 dose. Our vaccine clinics are a community effort, and we can always use more volunteers to help with registering and screening people, traffic flow, monitoring, and other tasks. A medical background is not required. Unfortunately, we recently became aware that due to technical difficulties, the volunteer sign-up function wasn't working on our website for several weeks. If you signed up to volunteer through the county website between February 4th and yesterday, we may not have received your email. I encourage anyone who contacted the health department during that time who didn't receive a follow-up response to please visit the health department's coronavirus page and click on the link for medical volunteering. The sign-up form is working correctly now. Thanks.
Thank you, Diane. The health department will resume rabies clinics at the end of March, beginning March 31st in Scriba. There will be 8 clinics this year, and residents will need to follow standard COVID-19 protocols, and appointments are required in advance. There's more information about this on the county website at www.oswegocounty.com. Thank you for everyone for doing your part to prevent the spread of COVID-19. Continue to be vigilant and enjoy the warm sunshine and spend some time outdoors if you can.